Welcome to the MS-Perspektive podcast, Perspective with a K as I'm German. I'm Nele von Horsten, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins. Thanks for tuning in again and welcome to episode number 115, Stem Cell Therapy for MS, a conversation with Professor Christoph Heesen. In this episode, I speak with Professor Christoph Heesen from the University Medical Center Hamburg-Eppendorf, the UKE, in Germany about stem cell therapy for people with multiple sclerosis. Christoph shares his clinical experience and gives a detailed overview of how the treatment works, who it may benefit, and what risks are involved. We also discuss a clinical study currently underway in Germany that aims to compare the effectiveness and cost of stem cell therapy with existing high-efficacy MS treatments like Lemtrada and Ocrevus. For patients in Germany, this trial could pave the way toward broader access and insurance coverage. This interview was originally conducted in German and translated into English for international listeners. Let's start with the introduction. Who is Professor Dr. Med. Christoph Heesen? He's a senior physician and head of the MS outpatient clinic at UKE Hamburg, specializing in neurology. His educational and professional background is that he studied medicine in Marburg and Kiel in Germany. He completed a clinical year in Bremen, Germany, followed by a brief period in London, UK. He did his doctoral research focused on autoimmune diseases and entered clinical practice during the advent of the first MS therapies, sparking an ongoing interest in treatment communication and therapeutic goals. Christoph, what made you choose neurology and MS as your focus? Ja, Nele, I've always been fascinated by neurology and immunology. During my studies, I also discovered psychoneuroimmunology, the interaction between psychological stress and neurological disease. I'm still deeply interested in understanding how stress affects MS and how we can support patients in managing that influence. Okay, Christoph, let's start talking about stem cell therapy in detail. When does it make sense for MS patients and who is eligible? Ja, Nele, it's mainly for patients with highly active relapsing MS. That means frequent relapses, increasing disability, and a relatively short disease duration. Ideally, patients are under 40 and have had MS for less than 10 years. Even some progressive cases may be eligible if they are still in the earlier phase. But it's important to understand stem cell therapy can reset the immune system, but it doesn't repair nerve damage. It destroys the existing immune memory, including vaccination history, and rebuilds it from scratch. That's why it doesn't help in later disease stages where neurodegeneration dominates. Thank you, Christoph. Can you explain how the treatment is actually performed? Of course, Nele. We are talking about autologous stem cell therapy, where patients receive their own stem cells back. That's safer than using donor cells. Also, the MS could, in theory, return. First, we mobilize the stem cells with a mild chemotherapy, usually cyclophosphamide. So they move from the bone marrow into the bloodstream. We then collect them through a process called apheresis, similar to plasma donation. The stem cells are checked for quality, frozen and stored. A few days later, patients return for the main part, conditioning. That's a high-dose chemotherapy which completely wipes out the immune system. Without stem cells, this would be fatal within weeks. But we reinfuse the collected stem cells, which then rebuild the immune system over the next 7 to 10 days. In Hamburg, patients typically stay 3 to 5 weeks in the hospital for this process. After discharge, patients go through a cautious recovery phase especially during the first 3 months. It takes about a year for the immune system to fully regenerate. Christoph, what are the main benefits and what are the risks? Yes, Nele, it's important to talk about that. Studies show that inflammation is reduced more effectively than with any other current MS therapy. The goal is no evidence of disease activity, no relapses, no new MRI lesions, no progression. That's achieved in 40% of cases with standard therapies, and in 60 to 80%, maybe even 90% with stem cell therapy. Another hopeful aspect, about 1/3 of patients may actually improve because the immune attack stops and the body's repair mechanisms can work again. That's why younger patients tend to benefit most. But yes, the therapy is high risk. In earlier days, 3 to 5% of patients died, mostly due to more toxic chemotherapies or pre-existing health conditions. Today, the mortality risk is under 1%. Still, it's a serious decision. In Hamburg, Germany, we've treated 20 patients so far. None have died. There are also risk of secondary autoimmune disease, 5 to 6%, secondary cancers, 3 to 4%, and infertility in both men and women. Fertility preservation is something we always recommend. Christoph, how do you support patients through the decision process? Most patients who come to us are already well informed, often through online communities like the German-speaking Facebook group for MS transplant recipients. We start with an initial consultation, give them time to consider, and continue the conversation from there. For most, this therapy is an option when nothing else has worked and their quality of life is severely affected. Then, risk and benefit can be meaningfully weighed. Christoph, what's the total treatment timeline? About 1 year. 1 week for mobilization, 3 to 5 weeks inpatient for the transplant, and at least 3 months for close follow-up. After that, it's up to the patient when to pursue rehab. Some wait up to a year to avoid the risk of infection from public facilities. Christoph, is rehabilitation recommended? There's no specific rehab protocol. Some patients feel very weak at first, others bounce back quicker. MS-specific rehab is generally a good idea, and staying physically active helps recovery. Christoph, what if someone has small children? Kids don't usually bring home dangerous infections, so the risk is manageable, especially if you can keep some distance for the first few months. But of course, the emotional strain from that separation is real, so we always talk through it individually. Okay, Christoph, let's come to the part cost and study participation. Who pays for this therapy? In Germany, stem cell therapy for MS is not covered by health insurance as a standard treatment. Some patients manage to get approval from their insurance. Otherwise, self-payment is possible, around 35,000 to 40,000 euros. Some go to Switzerland, London, Mexico, or Russia. At UKE Hamburg, we only offer the treatment through a clinical study or with insurance approval. Christoph, what makes the study in Hamburg unique? It's for patients with relapsing MS who have failed standard treatment, are under 50, and have had MS for less than 10 years. We compare stem cell therapy with Lemtrada or Ocrevus, aiming to show that stem cells are not only more effective, but also more cost-efficient in the long term, which could lead to insurance coverage. Participants have a 50% chance of receiving stem cell therapy. Those who don't may receive Lemtrada or Ocrevus. If those don't work, they can still receive the transplant later. Similar US studies showed that about half of the patients eventually received the transplant anyway. We need 50 patients total, and we expect that will take around 5 years. Other study sites in Germany currently include Mannheim and Dresden, with Düsseldorf potentially joining. Patients from across the country are welcome. Okay, Christoph, let's move on to the quickfire round. Complete the sentence. For me, multiple sclerosis is? For me, multiple sclerosis is a highly variable disease that requires high-end industrial strength therapies. What breakthrough would you like to see in the next 5 years? I hope stem cell therapy becomes established as a standard option. Also, I'd love to see more awareness around physical training and endurance as a means of regeneration and prevention. And finally, Christoph, what message would you like to leave for listeners? Find your own path with MS and look for doctors who will support you on it. Yes, that's a good one. Christoph, thank you very much for the interview and the comprehensive insight and overview of stem cell transplantation and multiple sclerosis. And for you, dear listener, please stay as active and informed and positive as possible. And as you know, if you know somebody who has MS or might be interested in the topic, please recommend the podcast and please give a rating on that platform wherever you are listening to it. Thank you and bye. See you next time. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.